Do you have knee pain and you're not sure if it's a meniscus injury or possibly a ligament?
Well, today we're going to go over some key aspects of knee pain and the origin, what tissues it's coming from, whether it's meniscus, ligament, etc.
And how to do this is taking a trip back down memory lane, looking at an old video from 2020 with Bob and Brad talking about this exact subject matter.
That's right. This video is very comprehensive. If you really want to learn about the knee and what your problem is, sit down, enjoy it, and maybe take some notes as well. So get a pad of paper and a pencil handy.
And Brad likes to time travel in a TARDIS because he thinks he's Doctor Who. So do you want to... Sam's going too because he's in that video.
That's right. You ready, Sam? We're going to jump into TARDIS. We're going to use our imaginations. Here, again, get that.
Oh, I knocked his whole hat off.
Get this thing spinning.
There we go. Spin it.
That makes Sam feel better. He's got his hat. Here we go. We're starting to shake into the TARDIS. Whoa, whoa, whoa. Here we go.
Bob and Brad, the two most famous physical therapists on the internet.
Knee pain, and people are always wondering, oh, geez, I wonder, is it my meniscus? People are talking about
cartilage,
meniscus.
if they say meniscus, cartilage.
There you go,
Yeah.
cartilage. Or is it that darn ACL? Or is it a ligament problem? So we're going to show you that very clearly.
The ACL is a ligament, by the way.
Yeah, exactly.
Yeah.
But, there's three other ones that could be the problem.
Right.
And that's what we're going to show you. First of all, let's take a look at Sam.
Let's do a little anatomy, just real quick.
So all the muscles are removed. We've got the bone, and we do have the tendon to the patella. We're going to take that patella and the tendon, remove it, pull it over here.
You got it?
And then we're going to open up the knee joint, and we're going to look at the meniscus first. So it's cartilage, and it's between the tibia and the femur. And to me, they always look like kind of two horseshoes, a bigger one.
And they aren't that pointed
smaller.
like this thing is.
Yeah,
That's a little weird.
It's a little exaggerated, but the shape is pretty much there. It's pretty similar to that. That is there for a cushion.
Right.
It stabilizes the knee, offers some cushion, but we're going to jump now to the ligaments. There's 4 ligaments that stabilize the knee, and we've got it open. The ACL, which is probably the ligament that you hear about in sports very often being injured and oftentimes tore, and surgery.
Or stretched.
Yep. Surgery can replace it. It's right here. It's this one. Then also right next to it, there is the PCL. ACL means anterior cruciate ligament. PCL, which is, I'm going to move this out of the way. It's hard to see, but it's back there. It's the posterior cruciate ligament. And they work together. They stabilize the knee from moving forward and backwards.
And cruciate means cross, so the ligaments do cross.
Yes, they do. This doesn't show that real well, but believe us. Now, we're going to look also at the MCL, the medial collateral ligament.
Right.
And here it is right here. What that does is that stabilizes your knee so it doesn't go out this way. What would that be?
That'd be valgus.
Valgus.
Yep.
What's the
varus.
Knock-kneed would be the slang term.
Right.
And then the LCL, the lateral collateral ligament, does just the opposite, keeps it from going in this way to get, if you were like bow-legged.
Bow-legged, right.
Mm-hmm. So that's the anatomy.
And that's the things that can get injured.
Right. Now we're going to talk about symptoms. And there is somewhat of a clear difference in symptoms. For example, meniscus. If the meniscus,
cartilage.
Yep, or cartilage. You like the cartilage. I like meniscus, but you're probably right.
I think a layperson's going to think.
Yeah, you're right. But if the cartilage actually gets tore, it can flip over. And if you ever hear someone say, my knee locks up, and then eventually it unlocks, and then it feels pretty good again, and they're fine. And then it happens again. I had one patient up and down steps, always lock it up.
Sure.
And she did it right in front of me at some stairs, and she locked up, and she went like this.
And got it back in place?
It was fine. And I said, we're done. I did a few other things, but I said, you got to go to the doctor. I feel confident it's a meniscus. And it was. The next thing is usually a meniscus does not have any bruising or like ecchymosis, we call it.
So if it's a recent injury,
yeah,
you may get some bruising with a ligament.
Yep.
But not as likely with meniscus.
Right. Also with a meniscus, it can kind of happen without any particular reason.
Right.
Over time, it just starts
wear out.
Yep, it starts getting sore, and then some little thing might happen, or maybe nothing, and then it's there, and then you get the locking and whatnot.
I'm just going to add this too, Brad. I if it's a acute injury, ones that just happened, you may hear a pop with a ligament, where you probably aren't going to hear one with meniscus.
Exactly
or
right.
Yeah.
Very common with ACLs.
Yeah. I heard
people at football stadiums say, I heard it in the stands.
I heard it in the stands.
Right.
Yeah.
Yep. Meniscus typically is not going to have that, but also with ligaments, whether it's ACL, MCL, or LCL, usually it's a traumatic episode or incident.
Yeah.
Oftentimes with sports, but it doesn't have to be.
Yeah, they don't often tear over time.
Yes.
Yeah, it's usually, like you said, it could be athletic event or a trauma from an accident.
Yep, a fall, etc. Ligaments will feel unstable. After
when you're walking,
swelling's done, that leg just does not feel. You don't feel comfortable on uneven surfaces, that kind of thing.
Now we should point this out too. It's very common to often injure a ligament and meniscus together in an athletic event.
Right, it's a good point.
Terrible triad. You can take on one.
That's right.
Right.
And oftentimes there's going to be a surgery, and they'll address it all while they're in there and take care of it. Now we got to talk about some tests.
Sure.
So should we go through the meniscus first?
Sure.
Now these tests, there's 3 of them we're going to show you can do all by yourself, and they're relatively easy. I like to do them. I use them on my patients on a regular basis. The first one is the Fesley.
Sure.
Okay, so Bob's going to do it, and I'm going to do it. First of all, you do it on the leg that doesn't hurt and see how it responds. And then the knee that does hurt, you're going to stand on one leg, have the patient hold on to the wall, or, you may have a stick or whatever. Bend the knee 5 degrees, which if you see
very slight.
You just get it so it starts to bend, and then rotate your body like this. We call this like in the other video, the disco dance.
Yeah, and think about it. You're grinding the joint to get together while you're doing this.
And that's kind of a overstatement. Hopefully, you're not grinding it. If it's a healthy joint, it's not going to be a problem.
Right.
If you do have a meniscus or a cartilage tear, it may cause problems and cause pain. And then you're going to go to 15 degrees, just a little bit further, not a lot, but just like what Bob did, repeat the test, looking for a problem or a tear in the cartilage in a different area. Now, if it hurts, it's positive. If it doesn't hurt, it's not.
Yeah.
The next one, Childress. Childress sign is, I called it duck walk. So feet are about a shoulder width or a little wider. Keep your toes in a natural position. Mine go out more. Some people will be more straight. You're going to bend the knees about till you're in this position. And so at that much flexion in the hips and the knees, and you simply do the duck walk. And you only take about 4, 5, 6 steps. And if that creates pain in the knees, that's a positive sign. Now, with these meniscus, we're going through 3 signs or 3 tests right there that you can do at home. I've got one more to show you. Oh, Bob, we might have did this a little early. Oh, that's all right. Oh, no, it's not. I'm sorry.
No, it's not early.
Yep. It's called the pear sign. And this one, you lay down. You can do it on the floor. This is a knee that's suspect of an injury. Put the foot right there on the knee and let that leg drop down just by gravity. And that stresses the knee. And if that also creates pain, if all 3 of those tests created pain, it's a pretty good chance you got a meniscus injury. Not 100%, but fairly good.
Or cartilage, or as some patients call it, cartridge.
Your cartridge.
Yeah.
Exactly. I'm going to show you, should we show them the 2 tests?
Sure.
These are 2 tests that you probably are not going to do at home.
Get in position for the Apley?
Yeah, we'll do the Apleys. This is what a therapist or a physician may do with you, just so you know. This is called the Apley's compression test. This is a knee in question. A towel roll, I've got a nice cushion here I put right there. That just keeps it's a little more comfortable for the patient. And what I do is I put pressure down, I rotate, and then I go down like this with pressure, with internal rotation and external rotation. And that will become uncomfortable, and the patient will complain of pain with that, and that would be positive. The next one is the McMurray's test.
Watch my microphone.
I got to shift you over a little bit, Bob, so I can squeeze in. All right. This one, again, therapist or doctors, take some practice on this one. We're going to rotate the leg. And I got to be honest with you, I don't use this one very much, and I never have since I learned it because I have a hard time with it.
Sure.
But you drop it down. I have seen some surgeons do it on a regular basis. They get real good at it. I've had really good luck with my other tests, so I feel confident.
Yeah, what I do, Brad, when I do this one is I actually put my hands right on the joint.
Oh, you do?
And then you can feel clicking.
Oh, okay. So you're feeling around that joint line, which, to know where the joint line is, that takes practice.
Right.
Most people cannot just say, "Oh, there it is."
Yeah,
I remember
exactly.
learning that initially. It's like,
yeah. So it's kind of a tough test to do. He's turning it, grinding it.
Yeah.
So.
But they may do that to you. Now let's look at the ACL, MCL, PCL,
Sure.
and LCL tests. These. You're going to be a therapist or a doctor to do.
Yeah.
It takes a little bit to learn it. I'm going to show you two of them for, one for the ACL.
And actually, a lot of times you'll do it on the good leg or the non-involved leg first.
Exactly.
Just to see what normal feels like.
Right. Exactly.
And then you test it on the involved leg.
Right. So if this is the in question leg, I'll do the other leg first, but the exact same thing. I'm going to grab under here, and this is called the anterior drawer test, and I'm going to pull this way, and that's going to see that's going to test the ACL. My thumbs right here are on the joint line, and you can actually feel movement. I can feel Bob's tibia come towards me as I pull on it. Now,
and if it's torn, it's going to move more on this one than it would on this one.
Exactly. And you can feel it. And there's not always pain associated with it either, like you may think there is.
Right.
Then the PCL, which I've never worked with anybody with a PCL.
I haven't either, to be honest with you, Brad.
Yeah, but it does happen.
Yeah,
not very often. You simply push this direction and compare the good one to the bad one, and you can palpate the joint line and see if there's more mobility. Now, the LCL and the MCL, can you scooch over this way, Bob?
Sure.
Usually they take you to the side of the bed. I'm going to do his LCL first. Can you just relax, Bob?
Yeah.
There you go. Thank you. And we do a little bend on the knee, and I'm going to push this way with this leg or with this hand and push this ankle in this way with this hand, and we're stressing that ligament right there. It's pretty tight, Bob.
No, I got good ligaments.
I don't feel anything there.
Never had any trouble. Always look good.
Now, normally, I'll do the MCL this way, and the MCL, I don't know if that one is injured more than the LCL or not.
I think it is often with other ones.
I'm going to
with the ACL.
Oh, right. I understand what you're saying. A combination.
Yeah.
Along with possibly meniscus.
Right.
Normally, I stand in front, but you can't see what I'm doing. So I'm going to do it here, and I'm going to hold here, slightly flex the knee to about 5 degrees. I'm going to push out this way. So I'm pushing his leg out that way, and then I can assess the integrity of that ligament there. Again, done by the therapist or the doctor, and you'll know what they're testing for.
But you can see that they're just putting stress on the ligaments, and if they're tore or stretched, there's going to be a lot more movement in this one, the injured one, than the non-injured one.
Exactly. Yep.
So, and that's the problem is, the knee gets sloppy then. And over time, if you don't repair it,
right,
it can put more stress on the cartilage and wear it out.
Yeah,
quicker.
Premature arthritis. It could lead into other issues.
I have two friends that
had
ACL tears that didn't repair them.
Yep.
One was a physical therapist, and he's now had knee replacement. And the other one, he's a friend, and he's had a knee replacement. So, and you get to our age, it starts to show up.
And a knee replacement, I think they take the ACL out and it's non-existent. So they didn't have to do that on that part of the surgery. I wonder if they gave him a discount.
That's right. I doubt it. There's no discounts in this world. So.
Whoa! Come on, Sam. We made it. It's okay. Put
put your hat up.
I've
We
been here.
we just like to have a little fun with TARDIS and time travel. We both came back. Now, that video is actually very comprehensive. Bob and I covered a lot of details. So if there's any questions, go back and look at it. We're going to go over some of the major points here, particularly if your leg or your knee seems to lock up going up and down stairs or while you're walking, where it hurts. It hurts to move it, but then if you sit down and you move it around and it unlocks, that's a strong indication that you have a meniscus tear, but you must get it confirmed by a doctor. They're going to do some tests on it and probably do an MRI to confirm it, and then make sure that the treatment is appropriate depending on the severity of it.
Now, if you do have a meniscal tear or ligament injury, oftentimes pretty obvious is just rest and modifying the activities you do for the time being can really help take some pressure off of that knee. So that includes things like squatting down, especially avoiding any deep squats or any type of twisting component motion to your activities. Try to avoid those for a while because they'll probably irritate that knee again.
That's right. If there is swelling associated with it and you're able to walk on it without any pain, you can do that. Do what Mike said as far as precautions. If there's swelling and pain, use a cold pack. You can never go wrong with that. You're just going to put it in the freezer. Get one that's gel that conforms and actually makes contact to the knee all the way around. I've actually had a lot of people put a cold pack here and then one on the bottom, sit in a recliner so there's contact on top and the bottom. It's going to be up to you. Use good judgment. You may only need one. Wherever the tender spot is, put it over that. Wrap the whole knee if you want. That's a good option.
Now, some good things to do later on is to make sure and strengthen your knee, as well as doing some gentle range of motion exercises. These can be done in a non-weight bearing position because oftentimes they will feel better. There's more videos on that specifically you could check out. We don't want to get into the details here, but most of the time, rehabilitating a meniscal or ligament injury can take up to 12 weeks. If you go the surgery route or not is obviously your choice. I have met people that have had surgery and have not. And oftentimes the ones that don't, some of them get better and they do fine. Some of them get better, but they kind of know in their mind they have these precautions or things that irritate it that they have to be conscious of until they actually have surgery or maybe get a knee replacement later on, like Bob had mentioned earlier in the video.
Right. And, oftentimes if you're younger, a meniscus surgery is not too complicated. They go in. Arthroscopically go in, debride it, get the folded area or whatever the problem is. And it's usually a relatively quick recovery. It's not like a total knee.
Yeah, so ligament can take quite a bit longer, so just keep that in mind. But most of the time, if you are someone more athletic and do a lot of things, sometimes surgery is the better option to choose. But again, do your research, talk to your surgeon, and decide for yourself.
There you go. Another video that we have 3 specific exercises that you could work with. What's it called?
Meniscal tear top 3 rehab exercises. Just click the video link on the screen to check that out.
Pretty straightforward. Good luck with your knee. We like to keep the knees healthy.
Bob and Brad, the 2 most famous physical therapists on the internet.